Hello and welcome to iClimb. My name is Maria Steens and I am a future occupational therapist, current occupational therapy student. Today I'm going to be talking to you about occupational therapy and how it can help someone with Parkinson's disease. So to kind of give you an overview of what occupational therapy is, it is a healthcare profession that is focused on maximizing participation or independence in someone's everyday life activities. So occupational therapists really work with their clients one-on-one to help them achieve their rehab goals and whatever is meaningful to them. So I'm going to give you an example because it can be hard to understand. In our lives, we put a lot of meaning in what we do every day. Filling our time throughout our day is kind of how we give our lives meaning. So for someone with Parkinson's disease, daily activities like dressing, eating, bathing, things like that, managing household tasks may become increasingly difficult as the disease progresses. Movement symptoms like tremors, stiffness, balance troubles, things like that can affect moving safely through your home, getting in and out of your bed safely, completing fine motor tasks like writing or buttoning, and non-motor symptoms like declines in memory or cognition, depression, troubles with sleeping, things like that, constipation. These things can further affect daily activities like socializing, toileting, even participating in leisure activities. So occupational therapy can come alongside of you and prevent some of these declines in your participation in things that are really meaningful for you. They can help you modify your environment, adapt tasks, and also provide skilled training to make things easier or safer for you. And so I don't want to leave you with just the definition of OT and what it can do for you, but some action items and some resources. So first of all, if you do have difficulties with, daily activities, you've experienced recent falls, or maybe you just feel like a general decline in your level of independence, then you should reach out to your neurologist or your family doctor and talk to them about getting a referral to occupational therapy. There are a couple different options, both outpatient occupational therapy, which you would go to a clinic and see a therapist, or home health occupational therapy, where they would come into your home. So your doctor will work with you to determine what you might be eligible for and what services would best meet your needs. So definitely consider talking to your doctor about occupational therapy if this sounds like something that might benefit you. And another resource that I would like to bring up to you guys is something called LSVT Big, or Lee Silverman's voice treatment Big. So this is a program that is delivered by both occupational and physical therapists, and it essentially works on increasing your movements into these normal and safer movements. We'll work with you at any stage of your disease on specific individual tasks that are most meaningful to you. And the way that LSVT Big is designed is to kind of go through 4 weeks, 4 days a week of this LSVT Big kind of specialized programming with you. So if you're interested in doing the LSVT Big program to help create more normal movements and safer movements, then you can look at finding an LSVT Big provider or clinician within your area by just Googling LSVT Big providers near me. Another couple options for you, if you are interested in getting some adaptive equipment to help you with your daily tasks, you may want to look into Easter Seals Crossroads or Good Samaritan Network. Both of these offer different equipment loans and rentals. And then lastly, if you're in need of some home modifications, maybe you want to install some grab bars, or maybe you're just not sure how you can make your home safer, but you feel that you've had a lot of falls, you can contact SICOA. It's spelled C-I-C-O-A, SICOA, or Easter Seals Crossroads, as well as Hand Incorporated or USDA Rural Development. So any of these would be able to provide you with some home modifications, both the evaluation process and the installation process. So I hope you found these resources helpful, and I hope you consider getting some occupational therapy services to help you live a safer, easier, more independent life. Thank you.